From Willis Towers Watson, welcome to Ion 65, a podcast for public sector employers concerned about retiree healthcare. We've talked a lot in our first three podcasts about the difficulties plan sponsors have with maintaining their Medicare healthcare programs. And we've explored some options they could use to reduce the cost of their retiree healthcare program specifically.
And John, let's not forget, we've talked a lot about the importance of my mission to preserve retiree healthcare for public employees.
We have, and you've convinced me it's a noble mission. But Marianne, how would a plan sponsor know that they need to make a change in their Medicare retiree healthcare program? Are there warning signs that they should pay attention to?
There are, John. And in fact, I recently did a webinar on this very subject with Governing Magazine. And in it, I shared my stress test for Medicare retiree healthcare.
Well, that sounds exciting. Would you be willing to share it with our listeners?
Absolutely. I'm happy to do it. It really should give plan sponsors a sense of if they have a problem with sustainability of their Medicare healthcare program.
How is it designed? Are there questions and answers?
Yeah, there's 7 questions, John. And if you answer yes to 3 or more, in my opinion, your retiree healthcare program could be in some serious trouble with sustainability.
All right. Well, can we walk through that stress test right now?
Absolutely.
Okay, let's get started. So, listeners, if you're taking notes at home, we're going to walk through these 7 questions. You tally yes or no for each one. And then at the end, if you have 3 or more, then you might consider looking at your retiree healthcare program, maybe making a change. So, all right, let's get started. Marianne, what's question number 1?
Question number 1, has your OPEB liability increased significantly year after year? And John, a little refresher, OPEB is other post-employment benefits, typically retiree healthcare. It's a number that plan sponsors have to report on their books, the future liability of their retiree healthcare. So if this has increased significantly year after year for your plan, then you need to give yourself a yes.
We've talked about OPEB liability before, Marianne, in the context of new rules that came out recently that require public sector entities or plan sponsors to publicly and clearly report their OPEB liabilities. That has an impact on bond ratings too. Is that right?
That's correct. And so, as we all know, local governments and state governments need to borrow money to build bridges, to build schools, to do all kinds of infrastructure and other items. And if they get a lower bond rating, then when they borrow that money, John, they're going to pay higher interest. So that's just another way they're going to be losing money. So you don't want to impact your bond ratings negatively.
Okay, so let's move on to question number 2. Is your solvency period less than 25 years or worse? Are you pay as you go? Can you explain this, Marianne?
Sure. So a solvency period is a measure that many plan sponsors use. They'll say things like, well, we have enough money in our fund to pay for health care for today, tomorrow, and into the next X number of years. It should be at least 25 years. It would be great if it was higher than that. But there's also a number of systems out there that are what we call pay as you go, meaning they don't have any funding. And so if you're less than 25 years or you're pay as you go, then you need to give yourself a yes. And let me just add, John, this is a tricky number. I have seen systems have 100 years of solvency, which sounds fantastic. And in a number of years, a short number of years, they go to only 10 years. And how did that happen? Well, maybe a new mortality table comes out and says everybody's living longer, so you're going to need more money because you're going to be providing retiree health care over a longer period of time. Everybody's lowering the assumed rate of return. And if you do that, then you're not going to be earning as much money on your fund, and therefore you're not going to be solvent for as long as you used to be. Even, John, a bad year in the stock market, I have seen really drop that solvency number. So if you're seeing that you're less than 25 years or worse yet, you're pay as you go, you need to give yourself a yes on the test.
Our next question is, have you read articles in the media about your unfunded liability?
And if you have, you need to give yourself a yes, John. It seems every day I pick up the paper or listen to the radio, and there is some system getting beat up about their huge unfunded liability. We see it on the pension side, and now we're seeing it more and more on the healthcare side. And this could get really ugly. It really makes the systems look bad, and it could create legislative activity to maybe get rid of that liability by ending the program.
Okay, here's question number 4. Is your group Medicare plan premium more than $250 a month? I can tell you there are going to be some listeners who are nodding their heads because I've seen some group Medicare premiums as high as $500 a month.
Yes, John, my experience is that these plans on the group side are the most expensive option for providing retiree Medicare health care. If we look to the individual Medicare marketplace, we generally see the plans cost about half of what a group plan is, sometimes even 2/3. If your group plan is that high, you're bleeding a lot of money and you need to give yourself a yes.
Marianne, many of these plans are more comprehensive than group plans. So retirees not only enjoy the lower premiums, but they get greater coverage as well.
That's right, John. And that leads to our next question. Is your plan design less comprehensive than plans in the individual Medicare marketplace? How does your plan, for example, compare to a Medigap Plan G, which, John, is 100% coverage on the medical side after just a $187 annual deductible? It's a pretty rich plan. So if your plan is not that comprehensive as that, there's a possibility that you're not competitive and you need to give yourself a yes.
Yeah, there really is great coverage out there in the individual market. Retirees like these plans, not just on the medical side, but many of them find them to be more affordable on the drug side as well. So you really have to consider this option when you're looking at these questions.
Yeah, and John, if your plan doesn't compare well on premium or coverage, you may find that retirees are leaving your plan, which leads to the next question.
That's right. Question number 6, are a significant number of enrollees leaving your group plan for the individual marketplace? If so, give yourself a yes.
And that, John, leads to the very last question we have. And that is, do you have difficulty recruiting and retaining public employees for key jobs like public safety due to reduced retiree healthcare options?
Yeah, Marianne, this is a really big deal, isn't it?
It is, John. First of all, in the public sector, there's been this trade-off for years where retirees come to a job, earn less salary, but know in the end when they retire, they'll have a stable pension, a decent retiree healthcare coverage. You're going to find people not as willing to come and work in the public sector. Some of these jobs we've talked about are very difficult if they don't also have those benefits to count on at retirement. The other thing that's important to note, John, is that on average, public employees start their career with the public sector at age 32. So they're closer to beginning thinking about their retiree healthcare, their pension, and those sorts of things.
Okay, so that was question 7, and that is the end of the test. So if you're a plan sponsor listening at home, and you answered yes to 3 or more questions, what should you do?
Well, you need to look at your options. John, as I work with public sector plan sponsors across the country, I see a number of them still having a MedSup plan. They still have their actives and retirees commingled. They might just have an RDS drug plan. The next step for that group is to go to a Medicare Advantage plan with an AGWIP, but that really doesn't save enough money. And you still have the risk of large drug claims, which for retiree group, drugs are a big part of the medical expenses. If you're not competitive on premium, your retirees are still going to leave you, which could put you into a really bad situation. So that's where I really would encourage plan sponsors to look to the individual Medicare marketplace as their next and maybe even the best option, in my opinion, it is.
Yeah, we've talked about this earlier on in this discussion. Out there in the individual Medicare marketplace, you can find a Plan G for around $180 that has only a small amount of money out of pocket every year, just an annual deductible of $187. That really could save money for both retirees and plan sponsors.
Well, and John, as you know, we spent a lot of time in our first 3 episodes describing the model of the individual Medicare marketplace and how it saves money. So I would encourage our listeners for a refresher, certainly listen to episodes 2 and 3 of ION 65 to learn more about that model, how it works, and how it can save you money for you and your retirees.
Okay, that's it for today. Thanks for listening to another episode of ION 65. I'm John Barquette, and on behalf of my co-host, Marianne Stager, thanks for listening. We'll talk to you soon.
Thank you for listening to ION 65 by Willis Towers Watson, a leading global advisory, broking, and solutions company serving thousands of employers worldwide. For more information on Willis Towers Watson solutions to manage employee risk, optimize benefits, cultivate talent, and expand the power of capital, visit us at willistowerswatson.com. You can find more episodes of ION 65 on iTunes. Share with your colleagues with hashtag ION65. That's EYEON 65. Join us next time